The Norton Thoracic Institute actually started as a so-called heart-lung institute 19 years ago. I was able to assemble a group of like-minded individuals who I think, in retrospect, had the right combination of enthusiasm and naivety in that we could actually start a standalone lung transplantation here in the desert. Fast forward 10, 12 years down the line, and all of a sudden we realized that we are a very high volume and very successful program, both from thoracic surgery, advanced pulmonary services, but especially in lung transplantation. I think in 2018-19 we were the largest volume lung transplant program in the country, and at that time we were still maintaining some of the highest quality indices in the nation, something that we've all been very, very proud of.
We are a high-performing team, I think only because of the people and the synergy that exists between all the different disciplines: pulmonology, thoracic surgery, interventional pulmonology, intensivists, and all our support staff. Not touch upon all the departments, but we all really need to come together to take care of one patient. And I think we do a good job at Norton. It's really the people, the synergy, the collaboration that makes this multidisciplinary team rotate and revolve in this fashion.
We've also prided ourselves on being able to take care of pretty much the sickest patients. It's very rare for us to refer anything out that we don't feel like we can take care of here when it comes to general thoracic surgery and lung transplantation. We have the expertise here to do those very difficult operations. And I think it also helps when you have high volume programs that you can take a little bit more risk in terms of taking care of patients that other people would not.
We went from a program doing 10 to 15 lung transplants to over 50 to 100 transplants here within 10 years of starting the program. In fact, we're one of the probably fastest growing programs that hit 1,000 transplants in a very short span of time, while still maintaining our quality and remaining as a top performer in the nation by the registry that monitors the transplant programs for quality, SRTR, Scientific Registry for Transplant Recipients.
My name is Jenny Stanley, and we're from San Antonio, Texas. Nobody in Texas that we called would retransplant me, and we happen to have family in Arizona, and we called St. Joseph's Hospital and talked to Dr. Walia, and he said he was willing to see me. The care is awesome. They communicate with you, and if there's something you need, they do their best to take care of it, answer any questions you have, any concerns. They're just awesome.
10 years ago, we received a significant gift from two of our most big supporters in the community, John and Doris Norton. And that gift 10 years ago was $19 million. And that gift allowed us to catapult the program, and with the investment of those dollars, it grew more investments into the program, into transplant, and everything we do at the Norton Thoracic Institute. Since the inception of the program in 2007, $130 million plus that we've received from the community, and not only from the community, but across the country. It allowed us to create the worldwide research support that we needed here, and to recruit the #1 researcher in the country, Dr. Kumar, who specializes in transplant rejection. And that, in turn, brought in National Institute of Health grants through Dr. Kumar's leadership, again, expanding and growing.
We're not just caregivers, we're people who are in community with others, who are journeying towards better health. If you think about the journey we've been on at the Norton Thoracic Institute over these last couple of decades, there was a need in Arizona, and we've met that need. We now are one of the largest lung transplantation programs in the country, a world leader in advanced pulmonary disease. People come to not only get care, but to learn how to take this care home to their communities.
It's the people. Genuinely, 2 a.m., 2 p.m. It's the people that love what they do. And again, I think it's the calling that everyone is here for. It's the mission, it's the patients that we serve. And at the end of the day, there's a passion beneath all of us that is what comes to the table. So we're not here for the day-to-day. We're not here for the paycheck. We're not here for the glory, the lights, the camera. We are here to really serve the patient population in need.
There's not a day where I get up and I'm not excited to come to work because of what we do here for the patients in the community.
I think what we've accomplished so far is the tip of the iceberg. We have incredible opportunity to continue to grow, to continue to be leaders in this nation, to continue to provide services not only to the greater city area here, but to the region. There are a lot of states nearby that don't have transplant programs. We expect to be able to continue to provide services outside of even Arizona. As we expand, as we partner with this entity of Common Spirit, which is now 170 hospitals in more than 20 states, I think the sky's the limit.